Hi, I'm Dr. David J. Levens. I'm a board-certified plastic surgeon in Coral Springs, Florida.
The opposite is sort of when you have too much breast tissue and you want to be smaller and also lifted. Do you often combine the reduction and the lift together?
Absolutely. I was going to say that, but I knew you would get to that. I mean, literally, I've had patients that say they come in for a breast reduction, plagued by large breasts, heaviness, etc. I did one today. It's one of my most common and favorite procedures. They tend to be very happy. But literally, some will say, I want my breast reduced, but will you lift it too? And of course, you have to lift the breast in order to reduce it. You don't have to reduce the breast when you lift it. When you lift, you can try to preserve as much volume as possible. You can't make it bigger. But if a patient has lots of volume, very droopy, then you're both lifting and reducing at the same time.
So you have a lot to work with.
Yes, correct. Yes. Yeah. Actually, the one today that I did is a lovely young woman who I did her surgery, I think 6 years ago. And she had a very nice result. She had a reduction and she came back very happy, but she, without gaining weight, she actually lost weight, has not had children yet. They just kind of were large again, but not quite as large. So we did a secondary reduction, which I've done a handful of those. And that definitely is, this is another thing that we can talk about with breasts, is that I think it's a kind of interesting, and it's probably more human nature, that with breast reduction, one of the most common complaints, if there is a complaint, is I didn't go small enough. I thought I was going to be smaller. Of course, if you gain weight or you go through menopause, it can happen, or pregnancies. And then the opposite is true for breast augmentation, that many women find themselves to say, I wish I went larger. So I kind of ascribe that to human nature. And, you always want the bigger car, the bigger house or whatever, it's, we're never completely satisfied. So it's just the opposite when it comes from augmentation to reduction.
Mm-hmm. How do you help determine the right size so we don't have to get a do-over?
Challenging. And I talk to the patient a lot, explain what it's all about, the approximate amount of tissue that's removed per cup size. And then I have them look at pictures. I used to just call them likes and dislikes, but I learned this from a younger woman plastic surgeon in New York who used the word inspo pictures, as in inspiration. So they look at my gallery of photos, they look at photos online, other plastic surgeons, and of course then they bring a picture of someone that's got clothes on and a push-up bra and cleavage. But I try to encourage them to look at clinical plastic surgery before and afters that show a matched before and after, that they can then say, hey, that kind of looks like me. I kind of like that result, or maybe that's a little too big, or maybe that's still too small. And that, along with my measurements and my judgment, will usually come up with the right result.
It's nice that you listen to the younger generation too, and don't just think that you know everything. They do have something to teach you.
I know I'm learning all the time, constantly.
Where can we find you?
My office is at 1725 University Drive, Suite 300, Coral Springs, Florida, 33071. My phone number is 954-752-1020. And then drlevens@drlevens.com is my email. Website is drlevens.com. I do have 3 Instagram pages, one with at Dr. David J. Levens, one is Plastic Surgery Talks, and one is Levens Med Spa.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at wherebeforemeetsafter. If you're a board-certified plastic surgeon and would like to be a guest or a sponsor of the show, go to wherebeforemeetsafter.com for more information. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics, THEAXIS.io.